In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday on Coping with Tre Tailor. Coping. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping. I'm Tre Tailor, and thank you so much for joining us. Today, we're coping with thyroid health. It's Thyroid Awareness Month, and Dr. Jane Kelly joins us from the College of Charleston. She's been with us before, friend to the show. Dr. Kelly, thank you so much for joining us today.
Oh, thank you so much for inviting me.
Absolutely. Plus, new mommy, Dr. Aundrea Loftley with the Medical University of South Carolina joins us also. She still looks beautifully, you were glowing like you just had a baby, which you did.
Thank you very much.
Thank you so much. Both of these ladies are going to join us coming up next to talk about thyroid health, that and more. Coming up next on Coping. I'm Tre Tailor, but first, your community updates. SCDHEC and Prisma Health are trying to combat the cold and flu season with free flu shots in Columbia and Greenville. Now, vaccinations are currently available in Columbia at 1401 Sunset Drive, Monday through Friday from 9 a.m. until 4 p.m. for anyone 6 months and older. COVID-19 rapid test kits will also be available at both locations. Richland County Council approved Project Golden Eagle yesterday. Now, this is a top secret initiative right now that will bring almost 2,000 jobs to the Blythewood area with an estimated $800 million investment. No word yet on what the actual company is until the deal is finalized. The proposed building has a site located off I-77 near exit 27 in Blythewood. And Dance and Ellen Show DJ Stephen Twitch Boss has died. The 40-year-old reportedly took his life earlier this week. The runner-up on season 4 of So You Think You Can Dance in 2008 joined the Ellen DeGeneres Show in 2014 and was named co-executive producer for the show in 2020. DeGeneres wrote today in a tweet that she was heartbroken because Twitch was pure love and light. Our condolences go out to his family and friends of Twitch. SCDHEC has your most up-to-date list of times, dates, and locations for COVID testing, flu shots, and COVID vaccinations in and around South Carolina. Visit scdhec.gov for more information. Now, scrolling at the bottom of the screen throughout the show, you will see information like where you can get 5 free rapid tests by logging on to covidtest.gov, COVID vaccinations for vets, which are happening at the VA, the various locations that are retail outlets that offer COVID vaccinations and tests, including Kroger pharmacies, CVS, that includes the CVSs located in Target stores, and Walgreens, all offering COVID vaccinations and also free N95 masks if you still need them. Also in Columbia, South Carolina, the Comet bus system is offering free rides to get your vaccination and also free shots. And also, if financial information that is located that you can see scrolling at the bottom of the screen, FEMA still has their COVID funeral reimbursement program. SC Bar Association and SC Legal Services has a toll-free number and website for rental and mortgage help. Lexington County has a bill assistance program. SC Housing and Dominion Energy has a rental and utility assistance program. And if you or someone you know are dealing with or coping with some problems, because we'll always be coping with something, the South Carolina Department of Mental Health has SC Hopes. It's a 24-hour assistance line. You're watching Coping. I'm Tre Tailor. We're giving you info and advice to help you thrive and survive in life because we will always be coping with something. This is Wellness Wednesday from In It Together SC and the Diabetes Action Council. And we are streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow. And also check out all of the great resources they have over on that page for you to live a healthy and happy lifestyle and where to get information on a diabetes prevention program. It's almost the new year, going through the holiday season. If one of your New Year's resolutions or one of the things that you really want to focus on for 2023 or the new year is to get your health in order, kind of manage your diabetes or pre-diabetes, the In It Together Facebook page and their website, as a matter of fact, are great resources where you can find help, assistance, information, and also support. We're streaming live on the In It Together Facebook page and their YouTube channel. So please don't forget to hit like, share, and subscribe. Now, we're also streaming live on the Tailor Made Production page on Facebook. That's the home of Coping with Tre Tailor. Please go over there and hit the like button and follow us and find out when we go live Wednesday for Wellness Wednesday from In It Together SC and the Diabetes Action Council, and also on Thursday and Friday. We're also streaming live on our YouTube channel. We'd love for you to subscribe to that. Now, there you can find 3 years of interviews, information, and resources on how to cope. We also have a presence on Instagram and also on Twitter. I'm Tre Tailor, and you are watching Coping with Tre Tailor. Wellness Wednesday is presented by In It Together SC and the Diabetes Action Council. When we come back, we're going to be joined by Dr. Jane Kelly and also Dr. Aundrea Loftley and talk about thyroid health. We're going to do that in 1 minute. We'll be right back.
Hi, I'm Donnie Ray Campbell with Richland County Sheriff's Department. As a strong advocate of healthy lifestyles and habits, I know that taking care of your health is important, which includes knowing if you have prediabetes. Prediabetes is a serious health condition that puts you at risk for developing type 2 diabetes, heart disease, and stroke. Visit inittogethersc.org and take the online test. This message has been brought to you by the Diabetes Action Council of South Carolina.
Computers, they're a part of our everyday lives. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
In It Together SC and the Diabetes Action Council present Wellness Wednesday every Wednesday here on Coping. I'm Tre Tailor. We are streaming live on the In It Together Facebook page and also their YouTube channel. Please go over there, hit like and share and follow and subscribe and find out all types of great information and incredible resources on a diabetes prevention program and how to get your life and your health back on track. We're also streaming live on the Tailor Made Production page. That's the home of Coping with Tre Tailor. And we would love for you to follow us there, hit like and share, and find out when we go live on Wednesday for Wellness Wednesday from In It Together SC and the Diabetes Action Council. And of course, then on Thursday and Friday, we're streaming live on the YouTube channel. Also, we would love for you to hit the subscribe button and find out about 3 years of information, interviews, and resources on how to cope. And then, of course, we've got a presence on Instagram and also on Twitter. We are coping today with thyroid health. Dr. Jane Kelly joins us from the College of Charleston. She is a friend to the show. She's been here several times. Newcomer and new mommy, Aundrea Loftley, is an associate professor of medicine and endocrinology at the Medical University of South Carolina. She's a Columbia, South Carolina native and also serves as the inaugural vice chair for diversity and inclusion at the Department of Medicine. Ladies, thank you so much for joining us today. We appreciate you.
Thank you so much for inviting us.
Absolutely. First of all, let's talk about the basics. What is a thyroid and where is it?
Absolutely. So this is a question I know Dr. Kelly gets asked a lot too, but to keep it simple, I mean, it's a butterfly-shaped gland and it's right in the center of the neck. If you're a man or male, then you can find your Adam's apple, and that's kind of an easy landmark. So the thyroid gland rests right around that area. It's very spongy, but it's shaped like a butterfly and about the size of a monarch butterfly.
Okay. All right. And then in a woman, I guess you can't see it as much because you said, Dr. Loftley, it's more like where you can find your Adam's apple in a man.
Correct. And I mean, if a woman has what we call goiter or thyroid enlargement or thyroid nodules, so you can actually have lumps and bumps that form on the thyroid gland, it can make the gland more visible, even in a woman or a man.
Now, what does a thyroid do, Dr. Kelly?
The thyroid is involved in what's called metabolism, basically how fast your motor runs. So a normal metabolism, a normal thyroid function, that helps govern how your sleep-wake cycle, your weight, your amount of energy, as well as many other things having to do with muscle strength, and control of other medical conditions. If someone has an underactive thyroid, for example, a condition called hypothyroidism, they can just feel tired, sluggish, weak, short of breath. They may get some swelling in their ankles. It can be vague, so that, easy to blame it on something else. Oh, I'm just tired because of the holiday season, or I'm not as strong because I'm getting older. And in contrast, if you've got an overactive thyroid, something called hyperthyroidism, well, imagine your metabolic motor, your energy motor going into overdrive, so that you might feel like you have a lot of energy, or it might be an uncomfortable feeling of feeling nervous, feeling shaky, your heart beating really fast. And either one of these conditions can be a real threat to your health if it's not recognized. The good news is there are easy tests, blood tests, to diagnose it, and there are many treatments available.
Great. Well, let's find out why or what does cause a thyroid problem. Do people just have it? Is it hereditary, or does something happen, Dr. Loftley, that causes us to have a thyroid problem?
Absolutely. So it's a mixed bag. In many cases, there is this genetic predisposition. So, just to kind of lay it out there, unfortunately, women tend to be much more likely to have thyroid disease. About 1 in 8 or 1 in 9
We
women
get
will have some.
everything.
I know. That's why we're superheroes, though. We carry
That's
we
right.
carry quite a bit. But 1 in 8 or 1 in 9 women will have thyroid disease, and I mean, really, that's about 10 times more likely in a woman than a male. So, the thing about thyroid disease is, if you are a woman, you're more likely to have it, and there is sometimes that genetic association. So it's not uncommon for me to see a patient and also be seeing her mother and her grandmother. Usually, those are autoimmune varieties of thyroid disease, and autoimmune is just a fancy way of saying the immune system, which is typically designed to fight bad things, so keep bad things out and protect good things. The immune system has become confused. And unfortunately, it believes the thyroid gland is a target, is a bad person.
Oh,
And
wow.
so the attack on the thyroid gland can cause, as Dr. Kelly mentioned, hyperthyroidism, or that overactivity. It can also cause the gland to shut down and not produce adequate hormone, hypothyroidism. There are a few other things that can cause thyroid disease that aren't quite as common, but we see them a lot. There's some environmental exposures. Viral infections, believe it or not,
Oh,
can
wow.
cause this temporary inflammation of the gland that we call thyroiditis. The beautiful thing about thyroiditis is it is self-limiting typically. Sometimes folks will become hypothyroid after resolution of thyroiditis, but in many cases, that inflammatory period may last about 6 months or so and goes away on its own. And then lastly, very interesting, I see a large number of folks that are on medications for the heart, particularly
Oh,
one
wow.
called amiodarone. So we're still using quite a good bit of amiodarone. It's just one of quite a few medications that can irritate the gland and cause some hyperactivity, and in some cases cause underactivity as well.
Aundrea Loftley is a medical doctor and an associate professor of medicine at MUSC. Dr. Jane Kelly, friend to the show, joins us from the College of Charleston. You're watching Wellness Wednesday from In It Together SC and the Diabetes Action Council. I'm Tre Tailor. You're watching Coping, hosted by me, Tre Tailor. And today we're talking about thyroid health. So, Dr. Kelly, I want you to jump in here. Dr. Loftley just kind of told us what can cause it. How early do you know if you've got a thyroid problem?
Well, for most people, the symptoms start insidiously. They sneak up on you. It's not something where you're fine one day and boom, the next day you're having problems. And that's really the challenge, that it can take quite a while before it is diagnosed. I've seen this happen, especially with the elderly. that that there'll be a difficulty with forgetting or lack of concentration, and it may be initially just sort of put down as, oh, this person's getting older, or even that they're sliding into dementia. And then when it's finally they're tested for thyroid disease and it's recognized what's going on, they have a dramatic change after their thyroid is treated. So I feel like the big caution here is to not simply blame symptoms on something as mundane as, oh, I'm just getting older, or, mom or dad is just getting older.
Yeah. Danielle Lake joins us. She says that in 2006, she said she had a protrusion in her neck, which was very observant. Her OBGYN saw during a routine visit for a pap smear. She immediately had her go to her endocrinologist. Turns out the lump was precancerous. She says she immediately had a thyroidectomy. 16 years later, she says she still thanks God for an observant physician. Danielle, thank you so much for joining us. Thank you for sharing that information. And yes, you're right. That was such a blessing that her physician kind of saw, hey, let me check this out. So is it something we should, Danielle saw something on her neck. That was one of her only symptom, really. What about, and I know, Dr. Kelly, you talked about being tired and some other things. How do we know we should get our thyroid checked as opposed to it could be something else? As you said, I'm just getting old. I'm tired. It's the holidays,
But, there is a real role for the routine physical exam. And, women will come in for an annual exam, a woman's exam, but, there's a role for all of us to get seen by a physician on an annual basis, just as a routine, the time to get your flu shot and schedule a physical. But certainly anyone who has symptoms, for example, that person who just talked about there was a lump. Certainly, if you find a lump, you don't want to just dismiss that as something probably not important. That would go for a lump, basically any part of your body.
Anywhere, yeah.
But symptoms like unexplained weight loss, that you're just losing weight for not because you're dieting or trying to lose weight, just unprovoked weight loss. That's a worrisome sign, and that's something that is a symptom that is very general. Could be from many different conditions. It could be from diabetes. It could be from cancer. It could be from a thyroid condition. The recommendation is, if you have symptoms, to try and find out why and schedule yourself for a routine exam.
Yeah, Danielle says that she was feeling tired also, but she thought, like you said, Dr. Kelly, it was from a hectic career at the time. Now, with Danielle and for people who, because I see a lot of men that kind of have a bigger Adam's apple than someone else. Dr. Loftley, can you feel it? Like if you swallow, does it feel like you have something in your throat?
So, and that's such a good question. So the Adam's apple is just this prominence in the center of the neck, and we all have it, but it's just more prominent in men than women. The thyroid gland itself is just that spongy tissue that is right around that area. And if you do have thyroid enlargement, oftentimes patients will say, yeah, when I went to eat something, solids or liquids, it seemed like something got stuck there right in the center of the neck. Or globus sensation is just the sensation that something's always there and you're clearing your throat. That's sometimes a non-specific way of raising our concern for maybe a nodule on the gland. Again, you can look at people and see goiter, enlargement of the gland from time to time. That's less common, but certainly you can. I don't want people to think that you have to see it in order for the disease to be there, because most often, if folks with thyroid disease, there is not visible thyroid enlargement. They may not be able to see or feel that anything's wrong. It's usually a blood test coupled with the symptoms that Dr. Kelly mentioned earlier that help us make the diagnosis.
Can you wait too long? I mean, what could happen if you have thyroid failure?
Oh, you can absolutely wait too long. And so this is really why it's imperative if you have symptoms, although thyroid disease symptoms are nonspecific, meaning they are not just specific to thyroid disease, you must get tested. There are extreme forms of both hyper and hypothyroidism. The extreme life-threatening form of hyperthyroidism is called thyroid storm. And I teach my students, storm is in the name. Most storms aren't good. A thyroid storm is not good. There is a pretty significant mortality rate if someone develops thyroid storm. And this is a condition where you are so overactive, you have so much circulating thyroid hormone that it starts to cause damage to other organs in the body, the
Oh,
heart,
wow.
the brain, the list goes on and on. And then there is the twin to thyroid storm, but for hypothyroidism. So the extreme form of life-threatening hypothyroidism would be called myxedema. And myxedema can lead to coma. And death. So, these are really extreme forms. We don't see, thank goodness, thyroid storm and myxedema every day. But we certainly see enough cases to know that it's important to be tested and screened, particularly if you have a family history or you have symptoms.
Yeah, please post and share this out so we can get the message to the masses. As Dr. Kelly and Dr. Loftley said, thyroid problems are a thing, and they're hereditary. The thing I always say about hereditariness, and Dr. Kelly has heard me say this several times. If you get frustrated, you can be doing all the right things and still get ... whatever that may be, high blood pressure, heart disease, diabetes, and you're starving yourself from eating sugar and eating rice, and then and because of hereditariness, you can still get it. Now, Dr. Loftley, you mentioned you could have underactive and overactive thyroid. So are those the two things that can happen with your thyroid?
Absolutely. So, and there's a gray area in between, but really, I want folks to just remember hyperactive or underactive, and hyperactive is hypothyroidism. Underactive, meaning not producing enough hormone, would be the hypothyroidism. So, those two entities. Mhm.
Dr. Kelly, can you chime in here and tell us what type of thyroid problems you can have? Are there certain different ones? I know Danielle mentioned that she thought it could have been cancer, but I know there is a thyroid cancer, correct?
There are several different types of thyroid cancer, and sometimes they will show up with symptoms like hyper or hypothyroidism, but sometimes they're silent except for there being a mass, there being a lump. So that's again why we so emphasize if you find a lump, that certainly you need to get it investigated. But I'd like to share a personal story, if I may.
Please.
My mother was living in another state. And I'm on the phone with her, and I just felt like there's something wrong here. I mean, her voice was shaky. It was like,
Oh, wow.
what? And she was speaking really quickly. I mean, it just was a peculiar conversation. And though she was in another state, it was driving distance. So I, drove to visit her for the weekend. Well, the moment I walked in the door, I knew something was wrong. She was
Really?
shaking. Her
Mm.
hands were literally shaking. And she was saying, well, I'm getting older. Sometimes people get a tremor as they get older. But she also had sort of this pressured speech where she was speaking really quickly, and her clothes were just hanging off her. I said, did you lose weight? She said, oh, I don't know. I don't weigh myself. She had hyperthyroidism.
Wow.
And,
Wow.
I got her to the hospital right away. She was not in thyroid storm, but I think about what if she also had heart disease, that sort of
Mhm.
thing, that extra stress could have made her heart disease worse. Fortunately, got her into her physician. It was easy to treat her hyperthyroidism. It was not from a cancer. It was from a different medical condition entirely. But I was really struck that she did not recognize what was going on
Or
wrong,
that
what was
something
going
was
on.
going on. Yeah.
Right, right.
Yeah. Yeah, and and that's the thing. I think, as women, as people, I can only speak about being a woman, but as people, as you say, we're busy, we're doing life, maybe kids, job, spouses, and you could just brush things off, as whatever. And you could really be having, a serious problem. What kind of tests are there to check to see if you have an over or underactive thyroid? Dr. Loftley, do you want to jump in here?
Sure thing. Yeah, most often blood tests. So you have blood tests, and then we also have diagnostic testing, which we can talk about in just a second. But if you suspect you have thyroid disease, or if your physician suspects you have thyroid disease, simply drawing a TSH level is a good place to start. There are millions of other things that we could order too, but I always tell folks, a good place to start is just getting a TSH level. We can also check some of the other hormone levels that go along with that. If we're interested in really, though, looking at the gland, if we want a picture of the thyroid gland, the next study that one might order is a thyroid ultrasound. And this is very non-invasive, not painful at all. It is very similar to the ultrasounds that women will have when they are carrying a baby, except the ultrasound probe is not on the belly, it's right in the area of the thyroid gland. There are some other scans as well, but by and large, thyroid ultrasound and blood tests are the most common way to assess whether or not someone has a thyroid illness.
Can we just ask our doctor for a thyroid test, Dr. Kelly? And how often should we get one? Should it be part of our regular yearly physical?
Not necessarily. I mean, I'd be interested to hear what Dr. Loftley has to say on this, but I don't think it would be recommended that everyone get their thyroid blood test every year. Certainly, if you have a family history of thyroid disease, hyper or hypo, or thyroid cancer, certainly if you're having symptoms, or if you have another autoimmune disease like type 1 diabetes, those are all things that put you at higher risk of having a thyroid problem. But certainly you can always just talk to your physician and ask for a thyroid test. What the physician may then say back to you is why? Why do you think you need a thyroid test? And then you can talk about whether you have symptoms or it's because of family history or just some other concerns. Insurance is going to vary in terms of paying for a thyroid test. And so I don't think we can really address that on this show today because it's going to vary so much. But of course, you can always talk to your physician, explain why you're thinking that you would like to have a thyroid test and would he or she recommend it.
Right. Dr. Loftley, did you want to jump in? Dr. Kelly said she'd be interested in hearing what you have to say about that.
No, well said. And I completely agree. A thyroid screening, as Dr. Kelly mentioned, is not recommended for everyone, meaning it's not something that we order routinely, even every year. But Dr. Kelly said it very well. If you have a family history, if you've got symptoms, if you have risk factors, as she mentioned, like other autoimmune conditions, it's certainly something that piques our interest and we start to screen more regularly.
Right. Danielle chimed in and she said she had a blood and diagnostic test. What are the difference between the two tests, ladies? And then we're going to go to break. Dr.
Yes, so sure. So blood testing is very simple. So as long as you aren't afraid of having your blood drawn, blood testing is just us pulling a couple of tubes, one or two tubes typically, from the veins. Usually we go in the arm. And diagnostic testing is a little bit different. Typically no blood draws involved there, but this is when you're getting scanned traditionally. So the thyroid ultrasound, again, being the most common diagnostic test to screen for thyroid disease, non-invasive, not painful. You can go to sleep while having your thyroid scan via ultrasound. And then there are a couple of other different ways. Probably one of the second most common ways would be to get something called a nuclear medicine study, so an uptake and scan. And it sounds scary to say nuclear medicine, but it's not. Not harmful at all. It's incredibly safe. That's a 2-day process. And we are just measuring, in that case, how much iodine your thyroid gland is capable of taking up. And iodine is used because the thyroid uses iodine as its food. It uses iodine to produce thyroid hormones.
Is one test better than the other, Dr. Kelly?
Well, they're different purposes. The blood test is the easiest one to do, and it's more like a screening test. And that will tell you if your thyroid hormone is too high or too low. But then the next step is to figure out why. Why is your thyroid too high or too low? And that's when you're getting into those diagnostic tests. So the blood test would always be the first test.
Dr. Jane Kelly is with the College of Charleston. Dr. Aundrea Loftley is with MUSC. They join us today to talk about thyroid health. You watching Wellness Wednesday from In It Together SC and the Diabetes Action Council. I'm Tre Tailor. And when we come back, as Dr. Kelly said, we'll talk about what some of those underlying conditions are that may affect your thyroid health. That and more coming up next on Coping. I'm Tre Tailor. We'll be right back. Thank you, ladies.
Hi, I'm Judy Gatson. As a news anchor, wife, and mom, I know how important it is to take care of our health. Part of taking care of our health is knowing if you're at risk of type 2 diabetes. Prediabetes is a serious health condition and puts you at risk for developing type 2 diabetes. It's estimated that more than 1.3 million South Carolinians have it, and up to 90% have no idea. Take a moment to visit inittogethersc.org to take an online test to find out your risk of prediabetes and how to join a diabetes prevention program that takes the guesswork out of losing weight, eating better, and being more active. You can learn new ways to stay healthy and sustain those changes over time. When you join, you'll even get support from a trained lifestyle coach to help you set and achieve realistic goals. Go to inittogethersc.org, brought to you by the Diabetes Action Council of South Carolina.
In It Together SC and the Diabetes Action Council present Wellness Wednesday. Every Wednesday here on Coping, I'm Tre Tailor. Thank you so much for joining us. We are streaming live on the In It Together Facebook page and their YouTube channel. Please go over there, hit like and share and follow. Find out about all of the amazing information that they have, including how you can join either a virtual or in-person diabetes prevention program. Get the help, support, and resources you need to get your health back on track. What a great way to kick off the new year, getting yourself together. You're worth it. And I know you want to be around for your family and friends. We're also streaming live on the home of Coping, hosted by Tre Tailor. That is the TailorMade production page on Facebook. We'd love for you to go over there and hit like and share and follow. Also, get notifications as to when we go live every Wednesday on Wellness Wednesday from In It Together SC and the Diabetes Action Council. And of course, also on Thursday and Friday, we're streaming live on our YouTube channel. Also, we've got 3 years worth of information, interviews, and resources available for you to thrive and survive, because we will always be coping with something. We also have a presence on Instagram and also on Twitter. I'm Tre Tailor, and we are talking today about thyroid health. Dr. Jane Kelly joins us from the College of Charleston, and Dr. Aundrea Loftley with MUSC also joins us. If you just joined us, please hit the rewind button, because these ladies have shared such great information about thyroid and thyroid health. I want to talk a little bit, Dr. Kelly, you mentioned earlier in the interview that there are some things that make a thyroid worse. And of course, we're sponsored by the Diabetes Prevention, Diabetes Action Council. So we're always, conscientious about talking about how those comorbidities, those underlying conditions, heart disease, high blood pressure, diabetes, affect other things. So do those things affect thyroid? Does it make it worse? Does it make it better?
There are certain diseases, that the comorbidities, as you mentioned, that put you at higher risk of thyroid disease. Type 1 diabetes, especially because it is autoimmune, meaning that the immune system has been attacking the endocrine system, and the immune system is actually attacking the cells that make insulin, and that's why a person may end up with type 1 diabetes. But people with type 2 diabetes also are at a little bit increased risk for thyroid disease. Now, I'm not quite sure why that is, but it's well known that both type 1 and type 2 diabetes can place you at increased risk for thyroid conditions. But there are many other autoimmune conditions, rheumatoid arthritis, lupus, for example, that place you at increased risk for this other thyroid condition.
Yeah. So those folks who have those types of conditions, what do they need to do, Dr. Loftley?
Absolutely. So, folks that have one, or really sometimes you have more than one autoimmune condition, if you have an autoimmune condition, you are certainly someone that should be screened for thyroid disease more regularly. Those are the patients or the folks that I will do a screening test on maybe once a year, just because I know the likelihood of developing autoimmune thyroid disease is increased. So if you have any of the conditions that Dr. Kelly mentioned, rheumatoid arthritis, I see lots of patients that have RA, as we call it for short. These are people that I'm a little bit more hypervigilant about with regards to screening. And certainly, even if you don't have an autoimmune condition, remember those symptoms and signs that were mentioned before. If you have those signs and symptoms, although they are non-specific for thyroid disease, meaning they can be related to something else, it's important to have thyroid screening as a part of your evaluation.
Right, right. We are in the midst of our global pandemic still. Has COVID affected thyroid conditions in any way?
You know, interestingly, I just had this conversation with a colleague about 6 months ago. In the earlier phase of the pandemic, lots of folks were afraid or not able really to get into a doctor's office. Certainly, telemedicine did many great things, but we started to see more people come into the hospital extremely sick. So I got consulted for more thyroid storm cases, more significant hypothyroidism or myxedema cases than ever before. And we think it's because folks were quarantined and afraid to get out. And, you know, going to the doctor's office means going into an office. And if you're like me and so many others, you can sometimes have the tendency to minimize symptoms just so that you can carry along and focus on what's seemingly more important. But in reality, nothing's more important than your health. So, you know, in my practice and certainly with our consult service at MUSC, we certainly saw an increase in the severity of presentation. So when folks were presenting with hyperthyroidism or hypothyroidism, it tended to be much more severe. Fortunately, we're seeing a lot less of that now. Things are starting to return to their pre-pandemic state. But I hope that answers your question.
Yeah, yeah, yeah. So, is there anything someone can do to prevent having a thyroid problem, Dr. Kelly?
Well, you know, in the days before there was iodine in salt, some people were at increased risk of getting a goiter, you know, a growth in their thyroid because their thyroid didn't get enough iodine from the diet. So nowadays, have you ever wondered why that box of salt says iodized salt? It's a public
Yes.
health intervention to make sure everyone gets enough iodine in their everyday diet so that they don't get a goiter. But other than that intervention, other than being, you know, physically active, eating well, generally healthy, I don't know that there is any specific health things that one can do to prevent thyroid disease. Most people are going to get enough iodine in their diet from without having to go out of their way to eat special foods. But the slide you just showed indicates that, you know, eating a wide variety of foods gives you a lot of not just the protein and carbohydrates and healthy fats that you need, it gives you those micronutrients, things that like iodine or like certain vitamins and minerals that you need just a little bit of in your diet. So I would say the biggest thing one can do to prevent thyroid disease is eating that balanced, colorful, trying to eat all the colors of the rainbow and fruits and vegetables. That maintaining that healthy diet is the best way to maintain a healthy body.
Well, it's interesting when you mention the salt, because we're always told to stay away from the salt,
Well, and it's true. I don't want to be promoting that everybody should go out there and start eating more salt. My point is
French fries, here I come.
My point is, 100 years ago, there was more thyroid disease because we didn't have iodine in salt. And so sometimes when we talk about, food supplements or things that are like having, like fluoride in the water, that there are reasons from a public health point of view of why we have added those supplements, because they help to prevent disease.
Right. Dr. Jane Kelly is with the College of Charleston. Dr. Aundrea Loftley joins us also. She's with MUSC. We're talking about thyroid health. It's Wellness Wednesday from In It Together SC and the Diabetes Action Council. I'm Tre Tailor. Please post and share this information so we can get the message to the masses. Danielle actually said, thank you to both of you for this information. She said so many other audiences need to hear it. I know for me, I just was not as familiar. I have a good girlfriend in Florence, Dr. Loftley, who mentioned, a couple of years ago that she was having some thyroid problems. And, you don't want to sound dumb. You say, oh, girl, what? You don't know what that means. You know what I mean? You just say, girl, I'm sorry to hear that. And, but and I don't think I am in the minority, really. You just don't know that kind of thing. So I have to ask, we mentioned the salt. What about sweets and alcohol? Is that good or bad? Is that something people need to steer clear of, because that could increase or decrease thyroid problems, Dr. Loftley?
There are some anecdotal things out there, but in terms of, lots of evidence to support sugar and alcohol consumption as being causes or triggers for thyroid disease, we don't have anything that concrete, but we do know that excessive intake or consumption of both sugar and or alcohol, that's going to increase your risk to develop things like prediabetes, diabetes, and all of these conditions, coronary artery disease or heart disease, right? And all of these conditions are associated with a significant amount of inflammation. And anything in the body that's pro-inflammatory or promoting inflammation is not good for the immune system, and it's certainly not good for thyroid health. So again, just to kind of clarify, I don't know that we have concrete evidence to say that, high sugar diets or excessive alcohol consumption can cause a specific type of thyroid disease, but we know the conditions that do result because of excessive, carbohydrate, sugar intake or alcohol intake can certainly lead to the development of thyroid disease.
Yeah. So how do you treat it, Dr. Kelly, when you are finally diagnosed with having under or overactive thyroid? And let's, I guess take both of them separately. What are the treatments? What do you take? And is this something you have to do for the rest of your life?
It depends upon the underlying cause. So I think the underactive thyroid is a little bit easier to think about conceptually. Your thyroid, if for whatever reason is not making as much thyroid hormone as it used to. Sometimes that can be simply a function of age. As people get older, certain body systems don't function as well as they used to. And the thyroid is a good example. Thyroid disease definitely is more prevalent among older adults, and hypothyroidism can often be very simply treated by just giving people thyroid replacement hormones. Now, but one still needs to look into why was their thyroid underactive, and that may be more complicated with some different tests. But I think more commonly, it's simply a lack of thyroid hormone just needs to be replaced with a pill. not difficult to treat for most people. Hyperthyroidism is a different story. I recently had a friend share with me his description of his experience. He's a psychiatrist, and he was having panic attacks. And he was thinking, what's the matter with me? Why am I just stressed out because of COVID or because of work-related changes? And he went to his primary care doc who drew thyroid hormone. Sure enough, he was hyperthyroid and needed to be treated. Now, the treatment for hyperthyroidism is going to depend upon the cause. There are conditions called Graves' disease. There are certain cancers that can give you an overactive thyroid. So, of course, that treatment is a little bit more complicated and depends upon the underlying cause. But I can easily imagine, here I'm telling the story of my friend who is a physician himself, but he didn't recognize his symptoms. He thought he was having panic attacks. He was having anxiety for sure, but not because of a psychiatric condition, but because he was hyperthyroid.
Wow. So is this something that you have to treat for the rest of your life, Dr. Loftley, or do the medicines, treatments, replacements help so that you don't have to continue to have this done?
Yeah, absolutely. In most cases, the treatment it's a lifelong commitment, right? A lifelong commitment to therapy. I will give one example of when treatment would not be lifelong. If you had just the inflammation of the thyroid gland, it's called thyroiditis. That is usually self-limiting, and it's something that is here one day and 6 months later, it could be completely gone. Even 3 months later, I've seen cases resolve. But in most cases where you have hypothyroidism, which would require thyroid hormone replacement, that's a lifelong commitment. And hyperthyroidism, very interestingly, Dr. Kelly mentioned there are several different ways we can treat hyperthyroidism. Most often, there is a lifelong commitment to those therapies as well.
Wow. Wow. So in general, what do we need to do, and just in general, to, I guess, make sure our thyroid is healthy and moving forward, how do we, what do we need to do to be more conscientious? Dr. Kelly, you can start.
I feel like I'm being a bit of a broken record to say, pay attention to your body and don't just dismiss it as, oh, I'm depressed. I always feel that way around the holiday season. Well, no, it might not be depression. It might not just be because you're stressed out at the holidays. If your body is calling out for help, pay attention. So if you're having symptoms, you need to consult somebody. And I know so many people don't have a primary care physician.
Right.
And I think it is important for all of us to establish care with somebody. Even if you feel like, oh, I don't have any medical problems, I'm a young, healthy person. It's always important to be connected to a medical system so that if you did have a problem, you would have a place that you could go to. So, my number one recommendation would be get yourself a primary care clinician, a nurse practitioner, a physician assistant, a physician practice. Get yourself plugged into a system. So if you have symptoms, you have a place where you can go. I know I've also seen some storefronts where it says, all lab tests here, that you could go in and just pay cash to get your blood drawn and give you some lab results. I can't recommend that because I feel like, do people know how to interpret the results?
Right.
Sure, it might say on the piece of paper, high, low, normal, but it's more complicated than that. Normal depends upon the setting. It is possible for you to have an under or overactive thyroid and misunderstand what the thyroid blood draw levels are. You need a clinician who is trained and knows how to interpret those numbers.
Yeah.
So I would really discourage going and just paying to get your thyroid checked by getting a blood draw. Go talk to your physician or clinician.
Yeah. Dr. Loftley, did you have anything to chime in on? And then Danielle had a final question.
Absolutely. I just want to say endocrinologists all over the universe are celebrating what Dr. Kelly just said. about not going and just randomly having, your blood drawn. You really want to make sure you're seeing a professional, somebody that really knows how to understand and interpret what's going on. The only other thing I'll add is something that we mentioned earlier, just emphasis on healthy lifestyle. So we know that folks that are more mindful and folks that are minding their bodies, they're eating healthy, they're exercising the appropriate number of minutes each week. These are people that tend to be more in tune to symptoms and signs that come along. And these are also folks that tend to lead healthier lifestyles. So just throwing in there the emphasis on taking care of the mind, the body, the spirit, the whole package, because that mindfulness will increase the likelihood that you will be aware or more self-aware if you were to have a sign or a symptom indicative of thyroid disease.
Wow. Ladies, thank you so much. Danielle had a final question. She wanted to know about Graves' disease. Is that what causes eye bulging? Thank you, Danielle.
So Graves' disease is an example of an autoimmune condition. And what Danielle is asking about, if you Google Graves' disease, you might see an illustration or a photo of somebody whose eyes are like wide open like that. What is going on there? Well, some of it is hyperactive thyroid. If you've got a hyperactive thyroid, you not only might have a hand tremor, but your eyes might be open wider than usual because of that stimulation. But they also get some fat pads behind the eyeball. There's a funny accumulation of some fat pads that actually push the eyeball out a bit. And that's the eye bulging that goes with Graves' disease.
All right, Danielle, thank you so much for your question. Thank you so much for joining us. And Dr. Jane Kelly with the College of Charleston, and Dr. Aundrea Loftley with MUSC. Ladies, thank you so much for joining us today. Thank you so much for giving us all of this really good, enlightening information that is really so timely, as you said, Dr. Kelly, both of you actually, because during the holidays, we think that some of the symptoms that could actually be thyroid are just because of the holidays. So I love that you said, don't just brush it off. Think about it. Could this be something? Because it could be something. It could be something. So ladies, again, thank you guys so much for joining us today on Wellness Wednesday from In It Together SC and the Diabetes Action Council. Happy holidays and congratulations again, Aundrea, on the baby.
Thank you so much.
All right, absolutely. Thank you both. We appreciate you. So listen, if you have a story or initiative that could help someone cope, please email Josephine at booking@copingwithtretatailor.com. We would love to get you on the show. If you have a product or service that could help someone cope, please email copingwithtretatailor@gmail.com. We would love for you to be a proud sponsor, just like In It Together SC and the Diabetes Action Council. They sponsor Wellness Wednesday every Wednesday here on Coping with Tre Tailor. Our other sponsors include Palmetto Media Connections, the Fifth Circuit Solicitor's Office, Attorney Byron Gibson, Agape Counseling and Training Services, Black Pages Black Expo, the Comet Bus System, and Computers Unique Dutch Square Mall. Thursday, we're rebroadcasting a show about sickle cell and the need for minority donations. 'Tis the season for a need for minority blood donations. So please check out Visha Jameson from the American Red Cross. Also, Friday, we continue our series, Happy Holidays, Less Stress. Inspirational speaker, trainer, and life coach Lakisa McGraw join us, along with my brother, Charles Smith. He's joining us from Albany, New York, to talk about his journey with our mom, how it affected him, how he dealt with it, and what happened in his life ever since. It's our series on Happy Holidays, Less Family Stress. In the coming weeks, we'll also talk about dealing with an incarcerated or ex-felon in the family. We'll also talk about the LGBTQ issue and talk about co-parenting and exes during the holidays. This series is designed to help you through those stressors that oftentimes affect us during the holidays so that you can have a less stressful holiday season and a great 2023. As usual, we leave you with a reading from Jesus Calling today, December 14th. Jesus says, "Rest in me, my child, forgetting about the worries of the world. Focus on me and let my living presence envelope you in peace. Tune into my eternal security. For I am the same yesterday, today, and forever." If you live on the surface of life by focusing on the ever-changing world, you'll find yourself echoing the words of Solomon. Meaningless, everything is meaningless. It's not, because when you live in collaboration with the Lord, it's the way to instill meaning into each of your days. Begin each day alone with me so that you can experience the reality of my presence. As you spend time with me, the way before you opens up step by step. Arise from the stillness of our communion and gradually begin your journey throughout the day. Hold my hand in deliberate dependence on me, and I will smooth the path out for you. That reminds me of one of my favorite scriptures that says, "He goes before us and makes the crooked places straight." Good God Almighty, I love that. I love that he's looking out for our future. I'm Tre Tailor. Thank you again so much for joining us on Wellness Wednesday from In It Together SC and the Diabetes Action Council on Coping, hosted by me, Tre Tailor. Until the next time, we wish you peace, abundant blessings. Take care. God bless. Stay well. And it's out there. COVID, colds, flu, RSV. I got 2 in here with me that have strep throat. So don't forget to wear your mask over your nose and under your chin. I'll see you tomorrow.
Coping, find peace of mind to survive through whatever. Coping, learning the way that we thrive all together. Coping, finding out what's real. Coping, we can heal, we can heal, we can heal. Coping with stress, coping with strife, bringing hope for success, for improving our life. Coping beyond hoping to do more than survive, ways to live a healthy life. Coping and promoting, learning what you can do, 6 ways to a better you. Coping, find peace of mind to survive through whatever.